expand on that a little bit? You talked a lot about advocacy and the impact that waiving of a copay has negatively on our profession and some of our advocacy efforts over the past few years. What kind of efforts does it take to move a government to the next level? I mean, will simply this do it, or is there other aspects that pharmacy is not doing? Like, I mean, we've for the longest time said, hey, we have to tell our story because we probably don't speak loud enough about it. So maybe I'll go to you, Alan, and then Paul, I'll get your perspective from New Brunswick as well.
Well, it's a great question, Dean. Certainly advocacy has, and the advocacy that we do at OPA, that Paul does with New Brunswick, and that every professional association is undertaking, it's imperative to keep those going, to seek fair and reasonable funding for the services that you as your pharmacists want to provide. They want to be enabled to do more for their patients. So we hear this survey after survey will tell us that pharmacists like the expanded scope of practice. So what this does is it will help to the stopping of the waiving allows us to have a more honest discussion. What we hear in the presence of waiving, as I mentioned earlier, you have knee-jerk types of reactions by pharmacy owners. I'm not saying all, but many pharmacy owners will try and trim their expenses in order to cover the lost revenues that they could have been collecting through the copays. So they may trim overlap. They may cut their hours of operation. They may cut their support staff by either not hiring sufficient pharmacy assistants or technicians, or not even hiring technicians and utilizing lower cost pharmacy assistants. I learned the hard way when I started my pharmacy, my first pharmacy. I used pharmacy assistants, and I got what I paid for. And I quickly shifted and I moved to technicians, and it made all the difference. But if we can live with a new sustainable model in a world where there's no waiving of copays, all of a sudden the advocacy messages around scope of practice, whether it's injections, whether it's prescribing for minor ailments and the like, all that messaging starts to become a little bit more profound and a little bit more tolerable and acceptable to governments.
And Paul, maybe agree or not agree, and maybe your perspective, and add to that if possible.
Sure, I agree with most of what Alan's saying. I guess, just in terms of the payers' context or their perspectives on things, and what people's perceptions are of pharmacists in general, we've done, as an advocacy body, we've done focus groups here, we do surveys and so on. So we have the surveys that you see constantly where pharmacists are highly trusted. When you ask people in that context, as a health professional, they absolutely value the services that pharmacists provide, right? But then when you start talking about money, their brain switches over to the business person. And so the public has this complexity with respect to healthcare in Canada and the payment component. So it's a little confusing. In fact, oftentimes when I meet with politicians here, on the one hand, they absolutely accept the health discussions, and then 5 minutes later, they'll be asking, if you could put a team in a golf tournament for a fundraiser, because they have a tendency to see you as a sponsor, not necessarily as a health professional. And I think we're unique in that. I don't think they see nurses or physicians in that context. So just providing that in terms of some background. The waiving of copays tells payers that, we make lots of money and that we don't need their money. And so that's a bad message, and I think Alan's done a good job of discussing that. I mentioned earlier that copay policies that have a fixed fee are also bad because it disconnects the consumer or the patient from the actual cost of the drugs and the variations that are happening within a drug plan. And, to Alan's point earlier about people not having the ability to pay, and so you have to keep that in mind. In the U.S., we see that especially people just don't get their prescriptions filled. The plan designs here in Canada are a little more sympathetic, and recognize, usually have an annual cap in terms of what your copays can be and so on. And so I think that's an important piece. And ultimately, from a payer's perspective, as an advocacy body, our job is to try to find alignment and fits with payers. And so we have to be sensitive, just like pharmacists are sensitive to their consumers, right? So we have to be sensitive to the payers' issues. And, in our province right now, there's still some issues with ER, congestions in the ERs, and we have passed legislation here that enables pharmacists to do a lot of things with respect to assessments for minor ailments and even prescribing in certain instances. But and for urinary tract infections, for example, here in New Brunswick, right? So anybody who's a pharmacist in Ontario probably can think right off the top of their head, almost in a daily occurrence when you have to deal with someone who has UTI. It's really an urgent issue. It's not an emergency, certainly, and that individual, especially if they've had them before, you know that you're the right person in the right place at the right time to help that individual. And so we're having some success with that program here, and yet it's not funded as an insured service by the department. And so our members are charging cash, okay? And we're now making presentations to third-party payers, employer groups, to say this should be a benefit under your plan, or at the very least under the health spending account. So position pharmacists as an advocacy group, position them as healthcare professionals in the right place at the right time. We provide flu shots here. We're heading into the flu season as well. We've been doing it now since 2010. And we're now saying to the Department of Health, not sure why you send so many vaccines to the physicians' offices. They're charging you $20. We're charging you $12 here in the province. And we negotiated that rate because that was the VON rate at the time. And so we're the low-cost provider. Why would you allocate such a large portion to the high-cost provider, right? So there's an alignment of interest. We happen to also know that the public really likes to come to the pharmacy to get their flu shot. And so those are the types of opportunities you need to look and be aware of. And then finally, maybe on a bad note, we also have to be aware of the fact that payers, governments, and third-party payers are really, their perspective on what they'll pay for pharmacist services is really clouded by this emerging biologics market right now, which is taking over, their budgets, right? So they're spending 25% of their budgets today on 2% of their prescriptions, and that's only going to get worse. And so when we are there talking as an advocacy group, knocking on their door, asking for expanded services or asking for fees for certain things, this is really what they have in their mind, right? So, we're trying to find solutions and collaborate with those groups, with them in terms of making sure that our healthcare system and our drug plans especially remain sustainable. So.